Polynice, and in this video presentation we are going to talk about the importance of specimen collection as it pertains to microbiology. In this video we're going to talk about the collection of tissue cultures, wound cultures, and bone marrow cultures, and the importance on why proper technique is needed for these. Essentially, microbiology is used to diagnose infections that are caused by microbes. And we use these cultures to determine the specific type of growth that is occurring for these infections or in these specific wounds. And as a medical lab professional, we are not on the floor or patient facing to collect these specimens, so we rely on other medical professionals such as nurses or any other patient-facing medical professional to collect these samples for us. And the importance of collecting these samples is to ensure that the type of microbes that are within that wound causing the infection are able to be properly stored in the correct environment to allow for growth when we are testing these microbes, and to help prevent contamination from normal flora that may be on top of the patient's skin. The first step to ensure proper specimen collection is to practice aseptic techniques. We have to provide a sterile environment for the collection before it begins. So with the medical professional, it is important that they are sterile. So proper hand washing techniques and the use of PPE should be used. And PPE such as gloves, a gown or a lab coat, or protective eyewear to protect themselves and to prevent contamination with the specimen.
This image will give you a visualization on why proper hand washing is very important, because as you can see before the hand washing, it's a lot of bacterial growth that you can see, but after the hand washing, there's little to no growth. So it's important that proper hand washing is handled. Even though you're wearing gloves and PPE, it's still important to properly wash your hands so that none of the specimen gets contaminated by your own normal flora or any contaminants that you may have on your hands. You can see by the image how the skin flora as well as other pathogenic substances can infect a wound. So you can see the epithelial layer of the skin, which is the top part of the skin, and you see the normal flora that is on top of the skin, as well as a potential pathogenic microorganism. In this case, it's Staphylococcus aureus. And when there is a wound or a cut or break in the skin, the normal flora as well as the pathogenic microbiomes can enter inside the wound. And even though there may be contamination in the wound already before we try to clean around the wound, we will prevent more contamination by cleaning the area before we take a sample.
When the specimen is being collected, we have to ensure that the area or the site is prepped or cleaned before anything is collected. So when we're talking about bone or bone marrow collection, this is typically done in an operating room where it is sterile. And of course, they will clean and prep the area that they are going to collect from, which may be the iliac bone or the sternum from the patient. And they would use a aspirating needle to aspirate the bone marrow, and right after it is aspirated, it is placed into a sterile container. And for tissue collection, we are using alcohol to disinfect the skin, and after the skin is disinfected, we will collect the tissue, and the tissue should be moistened with sterile saline to prevent it from drying. And that is stored into an anaerobic container for transport. For a wound culture, we are going to clean around the area with sterile saline or alcohol. And for a superficial wound, you would use a swab kit and would swab around the area and then place it into the transport media, which can be a liquid that is in a tube, and that is used to be transported to the lab. And with a deep wound, we will aspirate it with a needle, and that would be placed into an anaerobic container or another sterile container.
This image will give you a visualization on swabbing and aspirating a wound culture. As I mentioned before, with the superficial wound, you would use a swab to swab around the wound, and you would use the needle to aspirate a deep wound culture.
When collecting a specimen with a swab, it is important to use the proper swab collection kit. So there are many different brands of swab collection kits, but most of them are essentially anaerobic transport, and they contain transport media in there to prevent the drying of the swab. Some of these swabs may be Dacron or rayon polyester, and some may also be cotton, but you should be careful using a cotton tip swab because some bacteria may be killed by the cotton because cotton is toxic to these bacteria.
This is an example of a swab collection kit. As I mentioned before, these are for superficial wound cultures. And as I mentioned, there are many different types of brands and types of swab collection kits, but each contain a transport media to help preserve the specimen. And that can be a sterile saline or a type of preservative that will not deteriorate the bacteria or microbes. And as I mentioned, it is important to use the right type of swab. Even though there are many different brands and many different types, some specific tests may call for a specific type of swab collection kit. And if that kit is not used specifically, then the specimen can be rejected.
After the specimen is collected, it is important that it is labeled properly before it enters the lab or before it is sent to the lab. So the container must contain the patient's information, must have their name, their date of birth, the medical record number, and any type of identifying information about the patient. It should also have the date and the time of collection, and it should also have the site or area where the sample was collected from. The specimen must be transported to the lab within 30 minutes of collection, or it will be rejected. And this is important because we are dealing with live bacteria, viruses, any type of microbes, fungus. So we need to make sure that we are putting these on a culture plate as soon as possible, or making these gram stains as soon as possible to see if there is any growth present. Because even though the microbes or the sample is transported in a transport media, they can still deteriorate if left too long. A sample will be rejected from the lab if the test on the tube does not match the requisition form. And this is where proper labeling comes into play, because the sample will also be rejected if there is wrong patient information or missing information, if the site is missing from the tube, if the date and time of collection is missing. that will also be grounds for rejection. Also, if a specimen is brought to the lab later than 30 minutes, like I mentioned earlier, it'll be rejected. Also, if a specimen is put into a fixative, such as like formaldehyde, that will also cause for rejection because it's supposed to be in a transport media, not in a fixative, which can kill off any microbes that are in the sample. The sample will also be rejected if it's in the wrong type of transport media. Like I mentioned earlier, there are many different types of transport medias and different brands, and specific tests may use a specific type of transport media and swab. So if the specific test is done in a wrong type of swab collection kit, then that is grounds for rejection as well. Also, if there's any containers that contain any leakages, those would be rejected. They have to be in a sterilely tight, closed container. Also, any specimen that is dry or dried out would also be rejected. As I mentioned earlier, with the tissue cultures, they need to be moistened with sterile saline and only sterile saline. I would like to reiterate again the importance of specimen collection as it pertains to these cultures, because in a study by Akif Urban on Fournier's gangrene wounds, it is shown that when collecting a sterile sample of the wound culture, it was helpful in determining on when to close the wound. Because in gangrene, it is very deadly. And not only is it deadly, but it's important that they get the right diagnosis on the type of bacteria that is growing in that wound in order to determine if they should leave the wound open and allow it to heal or to close it up and allow it to heal. They have to see how advanced the infection is before they could close the wound. And that's why specimen collection is important, because if the collection is contaminated with the normal flora or is contaminated with any other type of microbes, they may think that the infection is more advanced than what it really is, or they won't be able to determine what bacteria is actually causing the infection. So that is important to be able to collect the proper way. When growing our cultures on media, we can tell if the specimen is contaminated based on which bacteria grows on it, because we can tell if there's a lot of bacteria that is normally in the normal flora compared to a bacteria that's actually causing the infection. And as I mentioned before, us as medical lab professionals are not there while the collection is happening, so we have no way to tell if it is properly being done. So that's why I made this video, to let other medical professionals know that are patient facing how to properly collect these samples and how important it is into determining the diagnosis of the type of infection in the patient. Thank you for watching my video.